in this session, we'll see CNS stimulants and CNS stimulants and antipsychotic drugs. So out of that, CNS stimulant is not much important for your GPAT Niper. Therapeutic uses of CNS depressant. So CNS depressant, they are used as either anxiolytic that can relieve your anxiety. They are used as a sedative in case of insomnia and other. They are used as anxiolytic anti-anxiety drug. They are also used as a sedative. They are also used as a hypnotics. They are also used as an anticonvulsant. Also have some application in the psychotherapy. So CNS depressant drugs, they have a lot of application, therapeutic usefulness that we have already seen. CNS depressant, we have seen that. As compared to CNS depressant, CNS stimulant have limited therapeutic uses. They have limited therapeutic applications. But still, we will see that chapter. So CNS stimulants and CNS stimulants and antipsychotics. We'll try to finish at least these two chapters today. So first of all, what do you mean by CNS stimulants? So those drugs which will increase the functioning of your central nervous system. So these are the drugs which will which will enhance the functional capacity of your CNS. So those are known as CNS stimulant. So they are not much therapeutically useful as compared to CNS depressant. CNS depressant का यूज ज़्यादा होता है, उसका एप्लीकेशन भी ज़्यादा होता है. CNS stimulant का उतना एप्लीकेशन नहीं होता. CNS stimulants, if they are used in the higher concentration, they may produce hallucinations, they may produce epilepsy and all that. Now, excessive stimulation of CNS is always followed by depression. So, if you try to stimulate your CNS, so it will be always followed by depression. ठीक है. So you might have seen, आपने देखा होगा कि जिसको कॉफी पीने की हैबिचुएशन है, so those who are addicted to coffee or any kind of CNS stimulant drug, he will be always feel drowsy because see, so CNS stimulant initially will stimulate your nervous system, will enhance your motor functioning and all that. Excessive CNS stimulation is always followed by depression, remember this. So if you try to stimulate your CNS excessively, so it will stimulate for particular time, but it will be always followed by depression. So if anybody is habitual for coffee or CNS stimulant drug, so he will always feel a drowsiness or depression. No doubt, at initially, after taking coffee, he may feel energy. He may feel energized. Okay, for a particular time, feel stimulation or energy or some motor functioning. So increase the motor functioning initially, but the stimulation is always followed by depression. So they have limited application. Remember, CNS stimulants, they will have limited application in the therapeutics as compared to depressants. Now CNS stimulant is also known as, remember this term, CNS stimulant is also known as analeptics. इसके ऊपर फार्मासिस्ट एग्जाम में क्वेश्चन ऑलरेडी पूछा है. So analeptics, these are nothing but the CNS stimulant. Okay, so those drugs which stimulate the central nervous system, they are known as analeptics. The term itself, analeptics, means what? So analeptic means picking up those who have been cast down, means those who have been little bit depressed, or the functioning of those which who have decreased the functioning of CNS. So that means analeptic means what? Picking up those who have been cast down. They stimulate entire CNS and respiratory center. So mostly analeptics means these are the drug which stimulate the CNS and respiratory center. तो जो रेस्पिरेटरी सेंटर एंड सीएनएस को स्टिमुलेट करेगा उसको बोलेंगे सीएनएस स्टिमुलेंट और एनालिटिक्स. रिमेंबर these terms. Analytics means these are nothing but the CNS stimulants, and they are mostly stimulant to your CNS and respiratory center. ठीक है, CNS को और respiratory center को stimulate करेंगे, and in the higher doses, or if the stimulation persists or the stimulation continues, they can cause convulsions, they can produce epilepsy. Okay, they can produce epilepsy. So analeptics are the drug, or CNS stimulants are the drug which stimulate the central nervous system and respiratory system. They are known as analeptics, and in higher doses, or if stimulation persists, they can cause convulsion. Okay, now classification of CNS stimulant, another point is important. So they may ask you question on this classification. First class, drugs directly acting on CNS. So directly acting on CNS. So they are subdivided into three types. First one is a cortical stimulant, second one is a medullary stimulant, and third one is a spinal stimulant. Okay, so those drug directly acting on CNS, जो CNS को stimulation करेगा. Okay, so they are further subdivided into cortical stimulant, medullary stimulant, and spinal stimulant. आपको मालूम है CNS means what? CNS is nothing but the brain and spinal cord. So CNS includes brain and spinal cord. We have seen in the nervous system. So CNS stimulant मतलब क्या? वो brain को stimulate करेंगे, spinal cord को stimulate. Okay. So they are further divided into these three. Directly acting on CNS. Those drugs which are directly acting on CNS, they may be either cortical stimulant, they may be either medullary stimulant, or they may be either spinal stimulant. Cortical मतलब क्या? Cortical areas, cortex, cerebral cortex. So these drugs they stimulate cerebral cortex. Medullary stimulant means those drugs which stimulate medulla oblongata. These are known as a medullary stimulant. And spinal stimulant means those stimulate reflexly to the spinal cord. These are the spinal stimulant. Now, what are the cortical stimulant? See the examples: xanthine alkaloids, amphetamine, methylamphetamine, methylphenidate, and piperidol. So these are the examples of cortical stimulant. So they may ask you the question like this: one of the following is not categorized as a cortical stimulant. So xanthine alkaloids, remember, caffeine, theophylline, theobromine. These are the xanthine alkaloids. Then amphetamine, methylamphetamine, methylphenidate, piperidol. These are the cortical stimulant. They are used to stimulate cortex only. They are selective in nature. They selectively stimulate the cerebral cortex. Now, medullary stimulant means they will stimulate medulla oblongata particularly or selectively. For example, picrotoxin, pentylene tetrazole, PTZ. इसको बोलते हैं pentylene tetrazole, PTZ. So, picrotoxin, pentylene tetrazole, nicotinamide, then amiphenazole, camphor, carbon dioxide. So, these are the medullary stimulant. So out of these, remember, medullary stimulant, they are not used therapeutically. So picrotoxin, pentylene tetrazole, nicotinamide, amiphenazole, camphor, इनका कोई use नहीं है. Okay, they are not used. So sometimes carbon dioxide is used to stimulate the respiration, but these rest of these drugs are not used. Now these cortical stimulant may find few application in the therapeutics. And remember one thing over here: this pentylene tetrazole (PTZ) is known as a it is a chemical that is used in the प्री क्लिनिकल ट्रायल्स. जैसे एनिमल जो स्टडीज होता है उसमें यूज करते हैं. So particularly pentylene tetrazole is used to induce the seizures. It is used to induce the epilepsy. It is used to produce the epilepsy in the experimental animals. जो mice होते हैं, जो rats होते हैं. So if you are want to study any particular extract for anti-epileptic activity, then you have different kind of models over there. Okay, so different models like chemically induced seizure or electro shock induced seizure. So in case of chemically induced seizures or chemically induced epilepsy, we have to use various chemicals. So in that, pentylene tetrazole is the first choice. Then picrotoxin is there, nicotinamide is there. So mostly these medullary stimulant, they are used in the animals to produce the seizures. Now third one is a spinal stimulant. Those stimulate spinal cord. For example, strychnine. So this strychnine is a nux alkaloid. Strychnine, okay, nux alkaloid. It is used as a dog poison. Remember, इसको यहाँ पे याद रखो. It is used as a dog poison. Try to write down these things which are not listed over here, but I used to say. Strychnine is known as a dog poison. ठीक है, कुत्ते को मारने की दवा. Now reflex stimulant to brain as well as spinal cord. So lobeline. Lobeline is from nicotine. Then ammonia, veratrum and nicotine. So these are the reflex stimulant. तो इसके ऊपर भी क्वेश्चन आ सकता है आपको. Which of the following is a reflex stimulant to, या फिर which are the cortical stimulant, which are the medullary. So याद रखो cortical stimulant xanthine alkaloid, amphetamine, methylamphetamine, methylphenidate and piperidol. Medullary stimulant picrotoxin, PTZ, nicotinamide, amiphenazole, camphor, carbon dioxide. Spinal stimulant कौन है? Strychnine. Reflex stimulant lobeline, veratrum, ammonia, nicotine. These are the this is nothing but the classification of your CNS stimulant. Remember CNS stimulant, they are also known as analeptics. एक term याद रखो, analeptics. Okay, and they are not only CNS stimulant, they are stimulant to CNS as well as respiratory center. So obviously their usefulness will be in case of apnea. Apnea means loss of respiration. Apnea means loss of respiration. So in that case, this CNS stimulant they are used analeptics. Okay, याद रखो ये things. Now we'll see the next point. Individual drugs. Now first one is the xanthin alkaloids. So xanthin alkaloids means xanthin. It is the term because it will give specific color. Xanthos. It is often from xanthin term is derived from the word known as xanthos. So xanthos means a specific color. When these alkaloids are treated with the nitric acid, they will produce a particular color. That's why they are known as xanthin alkaloids. They will have a specific ring system in the structure. Xanthin ring. Okay, pyridine 246 trion. pyridine का ring और उसपे 246% पे ketone group. pyridine 246 trion. That is xanthin. So these alkaloids are nothing but the caffeine, theophylline, theobromine. These alkaloids are nothing but the caffeine, theophylline, theobromine. So these alkaloids are obtained from either Caffeia arabica, कॉफी का जो प्लांट है उसमें से मिलता है या फिर टी में भी मिलता है. So Theacynesis. Tea means Theacynesis, coffee means Caffeia arabica. So these are alkaloids known as a xanthin alkaloids. Okay, they are naturally obtained from Coffea arabica or Theacynesis means tea or coffee and Theobroma coca. Theobroma coca में भी ये मिलता है. Xanthos means the leaves of this yellow residue when treated with the nitric acid. ठीक है, xanthos means a yellow mass. Xanthin क्यों बोला इनको xanthin alkaloids because they will have these alkaloids will give yellow color when treated with the nitric acid. Now these alkaloids they are used as CNS stimulant. तो उनका mechanism क्या है, कैसे stimulate करेंगे, what is the mechanism of action? They used to bind, okay, by inhibiting the cyclic nucleotide phosphodiesterase. They inhibit the cyclic nucleotide phosphodiesterase, and that's why inhibition results in the increase in the cyclic AMP and cyclic AMP in increase in the conversion of cyclic AMP to cyclic AMP to 5 dash AMP. So increase the concentration of this will lead to hyperexcitation or stimulation. Then again, they also bring they also make changes. They will bring about the changes in the distribution of calcium at intracellular sites. Neuronal जो cell होता है neuron. So neuron cell, inside the neuron cell there is a negative potential. Outside the neuron cell there is a positive potential. So if any cations goes inside the neuronal cell, there will be depolarization and stimulation of response or nerve. If any anions go inside, that will cause hyperpolarization and inhibitory effect. Okay, so these xanthan alkaloids causes changes in the distribution of calcium. मतलब ये calcium को अंदर भेज देंगे. That will cause depolarization and stimulation. So by inhibiting the cyclic nucleotide phosphodiesterase, they increases the conversion of cyclic AMP to 5-AMP, adenine monophosphate. They also bring about the changes in the intracellular calcium level, and they also block the adenosine receptor. So these are the three mechanism. They act by these three things. तो ये याद रखो, आपको सिर्फ इतना याद रखना है. Phosphodiesterase, they inhibit the phosphodiesterase. They are the non-selective phosphodiesterase inhibitor. Then they also causes changes in the distribution of calcium in the inside the cell, that is intracellular side. Also inhibit the adenosine. This is the mechanism. उनका ये mechanism है. इसके कारण ही वो stimulant action दिखाएंगे. They are stimulant because of these three things. Now we'll see the individual drug. So pharmacological actions of your xanthan alkaloids on various body system. Pharmacological actions of xanthan alkaloids. So xanthan alkaloids क्या करेंगे? Cerebral cortex के ऊपर क्या करेंगे? So xanthan alkaloids, pharmacological actions of xanthan alkaloids. So in a smaller dose, that is a 150 milligram, for example caffeine. If you take a 150 milligram caffeine, so it stimulate mental activity. It will stimulate the cerebral cortex. So it will stimulate the mental activity or it will stimulate the cerebral cortex. It will improve the motor functioning. जो आप परफॉर्मेंस, जैसे आप कोई वर्क कर रहे हो, जैसे पीते हो ना आप, आपको थोड़ी सी थकान हो गई तो आप कॉफी पीते हो, बिकॉज दैट विल अफेक्ट योर cerebral cortex, that will improve your mental functioning, mental ability, that will also improve your motor performance. आप जो काम कर रहे हो उसको performance increase होगा. So in the smaller doses that stimulate the CNS, that stimulate the cortex improves the motor activity, improves the physical functioning in large dose. In large doses, so if you take this caffeine in a large dose like 300 to 500 milligram, so it will cause irritability, nervousness, confusion in the thoughts and insomnia. Insomnia means lack of sleep. आपको नींद नहीं आएगी. Insomnia means lack of sleep. जो कैफीन का addiction होता है जिनको उनको नींद नहीं आती. Okay, then headache and tremor. So in a smaller dose, they will stimulate the CNS. They will improve your physical performance. Okay, motor activity. They will improve motor activity. But if you take in a large dose like 300 to 500 milligram, so that will cause adverse effect on the CNS. So it will cause irritability, nervousness, irritation हो जाएगा आपको, irritating behavior, nervousness, confusion in the thoughts and insomnia, headache and tremor. So in a smaller dose they are useful. Now this is the action on cerebral cortex. Now what is the action on medulla? So it stimulates the respiratory center. Okay, caffeine, theophylline, theobromine. It stimulates the respiratory center, vasomotors and vagal center. Okay, vasomotor center मतलब ये इसको stimulate होगा तो क्या होगा? Vasoconstriction. Vagal center in large doses. So it stimulates the respiratory center, vasomotor center and vagal center, vagus nerve, spinal cord. It increases the reflex excitability in very large doses and can cause convulsions in the animals. ठीक है, स्मॉल डोसेज में सिर्फ सेरेब्रल कॉर्टेक्स को स्टिमुलेट करेगा, मिडिल को थोड़ा बहुत स्टिमुलेट करेगा. अगर डोज इंक्रीज किया तो स्पाइनल कॉर्ड को भी स्टिमुलेट करेगा और कन्वर्जन करेगा. कन्वर्जन मतलब इपिलेप्सी. व्हाट इज एक्शन ऑफ दिस कैफीन ऑन हार्ट? सो इफ यू टेक कैफीन और इफ यू टेक ए कप ऑफ टी, आपको मालूम है टी लेने के बाद क्या, obviously as they are stimulant, so they are known as a stimulant. Okay, so they will stimulate your myocardium and increase the heart rate. They will stimulate the myocardium of your heart, muscular layer of, then they will stimulate heart rate also. They will increase the heart rate, force of contraction. So that means what? Positive chronotropic action. Okay, positive inotropic, positive chronotropic action. ये दो एक्शन होता है. लुसिडोपिक एक्शन भी होता है. देयर आर थ्री काइंड ऑफ एक्शन ऑन हार्ट: इनोट्रोपिक एक्शन, chronotropic action and lucidopic action. So inotropic मतलब क्या? Increase in the force of contraction. Inotropic. Okay, chronotropic मतलब क्या? Increase in the rate of contraction. So they have positive chronotropic action on heart. In large doses, caffeine will cause palpitation, tachycardia and occasionally cardiac arrhythmia. That is action on heart. Are you getting? Now action of caffeine on blood vessel. So blood vessel पे क्या है? As they act on vasomotor center, they are known as a peripheral vasodilation. They will cause peripheral vasodilation. जो periphery में blood vessel है उसको dilate कर देगा. So obviously because of peripheral vasodilation, the preload on the heart will be decreased because it increases the cardiac preload. Okay, so sorry, it will increase the cardiac preload. कि peripheral vasodilation होगा मतलब blood कहाँ पे रहेगा? Periphery में रहेगा, तो cardiac सिस्टम के ऊपर preload बढ़ जाएगा. Dilation of coronary artery, dilation of coronary blood vessel, constriction of cerebral blood vessel, जो ब्रेन में ब्लड वेसल है उसको कंस्ट्रिक्ट करेगा. रिस्पॉन्सिबल एंड दिस एक्शन इज आल्सो रिस्पॉन्सिबल फॉर द रिलीफ ऑफ हेडेक इन केस ऑफ माइग्रेन. ठीक है, आपको अगर थोड़ा सर दर्द कर रहा है तो आपको क्या बोलते हो? कॉफी भी लेते हो या फिर चाय पी लेते हो. तो उससे क्या होता है आपके जो, व्हाट डू मीन बाय हेडेक? हेडेक इज बिकॉज ऑफ द वैसोडाइलेशन इन द सेरेब्रम. सेरेब्रम में क्या होता है? ब्लड वेसल डायलेट हो जाते हैं. बिकॉज ऑफ वैसोडाइलेशन देयर इज इंक्रीज इन द परमिबिलिटी ऑफ ब्लड वेसल, so there will be movement of your content of blood in the cerebrum. That's why you feel headache. So now these are caffeine and all these, they do vasoconstriction in the cerebrum. That's why they will relieve your headache. जैसे आप चाय पीते हो या फिर कॉफी पीते हो, आपको सर दर्द होने का, they will also cause dilation of pulmonary blood vessel. Pulmonary blood vessel है जैसे bronchial blood vessel, so they will cause. This is action on blood vessel. Now blood pressure. So obviously it is unpredictable initially increase in the blood pressure. Okay, because of their stimulant action on heart. So initially they will cause increase in the blood pressure because of stimulant action on heart, but that will be counteracted by vagal stimulation because they are also stimulate the vagus nerve. On the kidney they have diuretic effect. Diuretic मतलब क्या? Increase in the urine formation. That is known as a diuretic effect. So in the kidney they will have a diuretic effect. They will promote the urine formation. and that's why if you take a tea or coffee or uh, tea or coffee, so you may after half an hour you may go to the washroom because of this diuresis. They causes diuresis. Now smooth muscles. So what is the action on smooth muscle? Relaxation of bronchial and other smooth muscle. Voluntary muscle. Voluntary muscle मतलब skeletal muscle. So they have strengthening of contraction and increase in the metabolism central as well as peripheral by central as well as peripheral action. So जो voluntary muscle है skeletal muscle है उसके ऊपर क्या है strengthening of contraction जो हो रहा है वो forceful होगा strengthening होगा. Okay. So these are the pharmacological actions of caffeine, theobromine, theophylline on a various body system: cerebral cortex, medulla, heart, blood vessel, blood pressure, smooth muscle, and voluntary muscle. Now we'll see next point. That is nothing but the absorption, distribution, metabolism, and elimination of these alkaloids, xanthan alkaloids. We have seen this absorption, distribution, metabolism, elimination of your xanthan alkaloid. कहाँ से absorb होगा, कहाँ पे distribute कैसे होगा, elimination kinetics क्या है. In short, so ADME of your xanthan alkaloids. So they are rapidly absorbed from oral administration. They are also absorbed from rectal and parenteral route. Now remember, this caffeine is 17%, theophylline is 20%, and theobromine is 3% bound to plasma protein respectively. After the absorption, these alkaloids they are basic in nature and that's why they used to bind to plasma protein. आपके प्लाज्मा में जो प्रोटीन है जैसे albumin, globulins, hemoglobin, alpha acetylglycoprotein and all that. Okay, बहुत सारी है आपने देखा है. So these alkaloids they after absorption they used to bind to the proteins. So out of that 70% caffeine binds to protein, 20% theophylline binds to protein, 30% 3% theobromine. So largely कौन बाउंड करता है, सबसे ज्यादा बाउंड करता है आपका थियोपाइलिन. सो थियोपाइलिन 20% 20%, theobromine 3%. So they are metabolized in the liver and by two process: demethylation and oxidation. Remember these alkaloids they are demethylated and oxidized in the liver. After oxidation, the product of oxidation will be removed in the urine. Now what are the adverse reaction of these? Now on the CNS को excessive stimulation करेंगे तो क्या होगा, confusion होगा, tremors मतलब involuntary movement of your muscle contraction हो गई unnecessary. Insomnia means lack of sleep, excitement due to prolonged stimulation, now ringing in the ears, headache and tachypnea means increased ventilation. Now GIT के ऊपर क्या इफेक्ट है, what is the adverse effect on GIT? So it will cause hyperacidity due to vagal stimulation. जैसे वेगस नर्व को स्टिमुलेट करते हैं तो इसलिए एसिडिटी करेंगे. nausea, vomiting, epigastric pain, particularly with the theophylline. तो theophylline ये मैक्सिमम करेगा. hyperacidity, nausea, vomiting, epigastric pain and ओके. नौशिया मतलब आपको, नौशिया मतलब उल्टी आना, वोमिटिंग मतलब, नौशिया मतलब मलमल होना, नौशिया मतलब मलमल, वोमिटिंग, इपिगैस्ट्रिक पेन मतलब आपके जीआईटी में पेन होगा पर्टिकुलरली विद द थियोपाइलिन. सो आपने देखा होगा जो चाय पीते हैं उनको एसिडिटी का प्रॉब्लम होता है बिकॉज ऑफ दैट कैफीन, दैट कैफीन और दैट कैफीन और कैफीन स्टिमुलेट द vagal center. Vagal मतलब vagus nerve, and vagus nerve has a vagus nerve is nothing but the largest nerve which are supplemented to your GIT area that causes hyperacidity. Now there may be a tolerance and habituation. तो इनका डे बाय डे आपको डोज ज़्यादा लगेगा तो टॉलरेंस हो जाएगा और हैबिचुएशन. तो आपने देखा होगा चाय के लिए, चाय के पीने की आदत पड़ जाती है लोगों को, कॉफ़ी पीने की आदत. ठीक है. सो दे आर प्रोन फॉर टॉलरेंस एंड हैबिचुएशन. Now, what are the therapeutic uses of these? So they used as a CNS stimulant. In case of migraine, they are also used in case of migraine along with the ergot alkaloids. जैसे migraine में जो one sided headache होता है आपको, उसमें भी ये caffeine is used along with the ergot alkaloids. Then they are also used in case of acute left ventricular failure, particularly this aminophylline. So aminophylline is used in case of bronchial asthma. Aminophylline का आप यूज करेंगे bronchial asthma. Theophylline and aminophylline. They are also used as a diuretic, mild diuretic. So they are a CNS stimulant. They are also used. They are also used in case of migraine along with the other drug, and they are used in the acute left ventricular failure most of them are used in the bronchial asthma, and they are also weak diuretic. So again, along with these drugs, so other drugs like amphetamine, methyl amphetamine, these drugs will be discussed in the another chapter when we'll see drug acting on sympathetic nervous system. At the time I will explain this amphetamine and methyl amphetamine. And piperazole, methylphenidate will be discussed in the when we'll see psychomotor stimulant. So this was about the CNS stimulants. Now we'll see medullary stimulants. This was a cortical stimulant. We'll see the medullary stimulant. Medulla oblongata को कौन stimulate करेगा? So brain stem and medullary central stimulant. I already told you these are will not have any kind of application in the therapeutic. So picarodoxine, pentylene tetrazole, nicotinamide camphor, they are no longer used therapeutically. They are used to induce the convergence in the mice in the experimental animals. जैसे मैंने बोला कि if you are screening any extract, if you are synthesized any kind of drug, anti-epileptic drug, and you want to confirm the activity, so you need to analyze that drug therapeutically, okay, using experimental mice. तो उसमें माइस में पहले इपिलिप्सी इंड्यूस करो, उसके बाद में आपका ड्रग दे दो, चेक करो कि इपिलिप्सी कम करता है या नहीं करता है. अगर करता है तो यूजफुल है, नहीं करता है तो यूजफुल नहीं है. So to produce the epilepsy, you have different kind of models, okay, like pentylene tetrazole induced seizures, nicotinamide induced seizures, picarodoxine induced seizures, और इलेक्ट्रोशॉक इंड्यूस्ड सीजर. जैसे माइस के जो छोटे छोटे कान होते हैं उसमें इलेक्ट्रोड्स लगा के उसको शॉक देने के बाद में उसको सीजर्स आएंगे, इपिलेप्सी आएंगे, फिर आप अपना ड्रग टेस्ट कर सकते हो उसको, like that. So they will not have any therapeutic application. Now doxapram is a non-specific analeptic drug. It is a non-specific CNS stimulant used as a respiratory stimulant. It is a non-specific analeptic doxapram. It is used as a respiratory stimulant in post and study period of the patient with hypoventilation, जिसको सांस नहीं आ रहा है. हाइपोवेंटिलेशन मतलब सांस का दिक्कत. So in case of hypoventilation, this doxapram is used as a respiratory stimulant. Then it is used to treat the opioid-induced post-operative depression, post-operative respiratory depression. जो opioid analgesics होते हैं जैसे fentanyl वगैरह, जो अपन प्री एनेस्थेटिक मेडिकेशन एज ए यूज करते हैं. So these opioid analgesics are also used as a pre-anesthetic medication to relieve the pain. Okay. So they sometimes causes respiratory depression. You know that we have seen in the morphine, in case of morphine, respiratory depression. To counteract that respiratory depression, to prevent that respiratory depression, or to counteract, to elevate that respiratory depression produced by these opioid analgesics, this doxapram is used. Then adverse effect like hypertension, tachycardia, arrhythmia, muscle twitching, tremors and convulsion. Adverse reaction देखो इसका hypertension, tachycardia, arrhythmia, muscle twitching, tremors and convulsion and vomit. These are the adverse effects. Now again another drug, methyl progesterone acetate. Methyl progesterone acetate. ये क्या है? Methyl progesterone acetate steroidal drug है. It is also a respiratory stimulant. It is having a respiratory stimulant action. It is used in the patient with chronic ventilation failure, chronic ventilatory failure due to prolonged obesity. That is known as a Pickwincke syndrome. Pickwincke syndrome. It is nothing but the ventilation failure due to obesity. तो बहुत ज़्यादा ओबेस होते हैं, ओबेसिटी जिनको है तो उनमें एक सांस लेने में दिक्कत होती है. तो chronic ventilatory failure due to pathological obesity, that is known as a Pickwincke syndrome. तो ये Pickwincke syndrome में यूज करते हैं मिथाइल प्रोजेस्टेरोन एसिटेट. ये याद रखो, डॉक्सेपाम एंड मिथाइल प्रोजेस्टेरोन एसिटेट, दीज आर द मेनली मेडुलरी स्टिमुलेंट ड्रग. ठीक है. ये बाकी के जो एपिक्रोडॉक्सिन वगैरह है इनका कोई यूज नहीं है, इनका यूज सिर्फ एनिमल्स में. लेकिन ये दो ड्रग doxapram and methyl progesterone acetate, they are used as a respiratory stimulant. Now what is the therapeutic uses of these analeptics? Uses क्या है इनके commonly? First, post operative respiratory depression. Post operative respiratory depression में यूज करेंगे इसको. Then ventilation failure or ventilatory failure in the patient with chronic obstructive pulmonary disease. जिनको COPD है, chronic obstructive pulmonary disease, तो उनमें ventilation फेलियर जो है उसके लिए यूज करिए। देन इट इज आल्सो यूज्ड इन द ट्रीटमेंट ऑफ प्राइमरी एपनिया इन केस ऑफ न्यू बॉर्न। जो नए नए जन्म में नए नए इस दुनिया में आए हैं बच्चे, उनमें अगर apnea हो गया, apnea means loss of ventilation. So primary apnea in the newborn, caffeine and theophylline mostly used. Then Pickwinkel syndrome we have seen. So that is the uses of analgesics. Now stimulant to the spinal cord. So those drugs which are stimulant to the spinal cord, for example, strychnine. This strychnine is nothing but the alkaloid. It is the alkaloid obtained from Nux vomica. It is a dog poison. It produces the convulsion characterized by extension of body. ये क्या करेगा आपको स्पाइनल कॉर्ड को स्टिमुलेट करके इपिलेप्सी करेगा, ठीक है। इट विल प्रोड्यूस अ कन्वर्जेंस characterized by extension of body and it is a competitive inhibitor of glycine. Glycine क्या है? It is a inhibitory neurotransmitter. Glycine and glutamate, GABA, glycine, glutamate. These three are the inhibitory neurotransmitter in the brain. We have seen that. What are the excitatory neurotransmitter in the brain? Which are the inhibitory one? We have seen in the previous sessions. If you have not seen, you can go and watch. Okay, glycine is a inhibitory neurotransmitter. ठीक है, अगर इसको inhibit करेंगे तो क्या होगा? Stimulation होगा. Okay, so that's why this strychnine produces the convulsions, produces the epilepsy. It is not used therapeutically. ये use नहीं करते. Now, by chance, if you got a poisoning due to strychnine, अगर एक्सीडेंटली आपको आपको स्ट्रिचनिन का पॉइजनिंग हो गया, या फिर जैसे क्राइम पेट्रोल में दिखाते हैं कि स्ट्रिचनिन का डोज देते हैं, ठीक है, मर्डर के लिए, होमिसाइड के लिए। सो इन दैट केस व्हाट आर द मेजर्स यू हैव टू टेक? सो स्पेसिफिक एंटीडोट फॉर स्ट्रिचनिन पॉइजनिंग, दैट इज आईवी डाइजिपम। इंट्रावेनस आपको क्या करना है? डाइजिपम का एडमिनिस्ट्रेशन करना है। तो डाइजिपम दैट इज बेंजोडाइजिपिन, देन पोटेशियम परमैंगनेट एंड यूनिवर्सल एंटीडोट। अगर आपने नक्सोमिक का सीड खाया है by accident, if you have eaten the Nuxvomica, so in that case universal antidote may prove useful. But if you are poisoned by injection of that strychnine and all that, so in that case diazepam, potassium permanganate, they are useful. यहाँ पे याद रखो कि specific antidote for strychnine poisoning is a diazepam. Now reflex stimulant to the spinal cord. There is a lobeline. It stimulates the CNS through chemoreceptors and carotid sinus. Also reflex stimulant to CNS also stimulate the autonomic ganglia. It induces the sweating. It is rarely used as a CNS stimulant. तो इसमें देखो ये दो ड्रग का ही ज़्यादा यूज है एज ए रेस्पिरेटरी स्टिमुलेंट, और जो कैफीन थियोफाइलिन वगैरह देखा था। तो ये पिकविंकन सिंड्रोम के बारे में याद रखो, इसके ऊपर क्वेश्चन आ सकता है। ड्रग यूज्ड इन द पिकविंकन सिंड्रोम, मिथाइल प्रोजेस्टेरोन and doxapram is also a CNS stimulant, particularly stimulant to medullary center, and it is used as a respiratory stimulant. Next one, that is the antipsychotic drugs. Next one is nothing but the antipsychotic drugs. What is meant by psychosis? Psychosis is nothing but the state of mind. So if you are if your thoughts are normal, if your behavior is normal, okay, that is a normal thinking or normal person. Now if your thinking capacity is not normal, so psychosis, so your psychic state are not normal, then you are suffering from any psychiatric disorder, that is known as psychiatrics. Normally what happens, there are three processes known as a cognition, then affection. Normal patient or normal person, they have three, affection and cognition. So normally what happens, normal humans में क्या होता है? Cognition. So some external stimulation will be there. जैसे कोई एक्सटर्नल स्टिमुलेशन, जैसे आपका आवाज आ गया, या फिर कोई स्मेल आ गया, आवाज, स्मेल, या फिर कोई बात करे, तो दैट इज अ कॉग्निशन. कॉग्निशन मीन्स रिसेप्शन ऑफ एनवायरमेंटल स्टिमुलाई. सो नॉर्मली रिसेप्शन ऑफ एनवायरमेंटल स्टिमुलाई, then that stimuli will be processed in your brain. So analysis of that stimuli, whatever information is received with the stimulus. जैसे बाहर कोई आवाज हो गया तो वो आवाज आपको मालूम होता है कि क्या चल रहा है, आपको कोई आवाज दिया तो आपको समझता है, या फिर आपको जैसे आपके एनवायरनमेंट में बहुत ही ज़्यादा ठंड हो गए, जैसे आप एसी में बैठे हो और एसी बहुत चिल हो गए, तो आपको स्टिमुलस मिलता है आपको एक्सटर्नल से। तो दैट गेटिंग एक्सटर्नल स्टिमुलस इज नोन एज अ कॉग्निशन. Getting a external stimulus is known as a cognition. Now that stimulant will be analyzed in the brain, that will be processed. The stimulus will be analyzed in the brain. Analysis होगा उसका brain में, और उसके बाद में एक्शन, उसका रिस्पॉन्स क्या देना है, उसके अगेंस्ट में रिस्पॉन्स क्या देना है, उसका एक पैटर्न आपके माइंड में डेवलप होगा. सो एनालिसिस ऑफ इंफॉर्मेशन रिसीव्ड एंड फॉर्मेशन ऑफ एक्शन पैटर्न एंड देन final action, nothing but the cognition. Cognition means actual behavioral response to that stimulus. तो नॉर्मली क्या होता है कि स्टिमुलस मिलेगा आपको एनवायरनमेंट में, आपको आप उसके ऊपर प्रोसेस करेंगे और बाद में आपका एक्शन प्लान डिसाइड करेंगे. नॉर्मली इट हैपेंस विद द नॉर्मल पर्सन. नाउ व्हाट इज मीन बाय psychic state? Psychic state means abnormal cognition, abnormal affection, abnormal cognition. Okay, so if there is a abnormally you are getting stimulus, आपको कोई आवाज नहीं दे रहा है फिर भी आपको लग रहा है कि नहीं यार मुझे आवाज दे रहा है. ठीक है, so that is known as a hallucination, delusion, illusion. So illusion, delusion, hallucinations. So if you are getting these things, so that means your cognition is affected. Okay, cognition is affected. That is one of the psychic state. Or any defect in the affection. So if you are getting right stimulus but your brain is not processing that stimulus in a perfect way. ठीक है, आपको स्टिमुलस मिल रहा है लेकिन आपका ब्रेन जो प्रोसेस कर रहा है, एनालाइज कर रहा है, या फिर जो पैटर्न बना रहा है माइंड में, तो दैट इज अफेक्टेड. ठीक है, आपको स्टिमुलस आ रहा है, जैसे आवाज आ रहा है, लेकिन आवाज आने के बाद क्या आप बहुत इरिटेशन हो रहा है, आपको इरिटेट हो रहा है कि कंटिन्यूसली कोई बज रहा है, खाता कोई आपके सामने सॉन्ग बज रहा है, आपको इरिटेशन हो रहा है उसका. दैट इज अगेन अ साइकिक बिहेवियर. ओके, दैट इज अफेक्शन डिफेक्ट और अफेक्शन प्रॉब्लम इन द अफेक्शन. नाउ कोनेशन मीन्स एक्चुअल बिहेवियरल रिस्पॉन्स. क्या हो रहा है कि आपके सामने कोई गाना बज रहा है और आपको बहुत इरिटेशन हो रहा है, मतलब दिमाग में आप इतना इरिटेट हो रहे हैं, उसको आप अब्यूज कर रहे हो, उसको माइंड में, सिर्फ आपके माइंड में अब्यूज कर रहे हो, आपको आपको लग रहा है कि इसको जाके पीटना चाहिए माइंड में ही, लेकिन आपने अब्यूज नहीं किया और उसको पीटा नहीं अब तक. सो दैट इज अफेक्शन प्रॉब्लम. ओके, कॉग्निशन प्रॉब्लम, अफेक्शन प्रॉब्लम एंड कोनेशन मीन्स एक्चुअल बिहेवियरल रिस्पॉन्स, कि आपने एक्चुअली उसको जाके दो तीन गाली दी या फिर उसको दो चार कान के नीचे बजा. दैट इज द एक्चुअल बिहेवियरल रिस्पॉन्स. सो any defect in the cognition, affection or conation that leads to psychotropic or psychiatric disturbance. Okay, so what is meant by tranquility? First we'll see what is meant by tranquility. Okay, tranquility क्या होता है? Tranquility means peace of mind. So if you have disturbed the peace of your mind, that means you have disturbed tranquility. Now to restore that peace of mind, tranquilizers are used. Tranquilizers. So what are the tranquilizers? These are the drug which produces calming effect without causing hypnosis and without affecting the uh, your normal process. Normal, whatever normal motor functioning is there. So without affecting the motor functioning, without causing the hypnosis, without inducing the sleep, these drug will produce calming effect. जैसे आपने देखा होगा कि कोई पागल आदमी है, बहुत ही ज्यादा एक्साइट होता है, सो ही इज एग्रेसिव, ही इज एक्साइटेड. ओके, ही इज एक्साइटेड, ही इज डिटैच्ड फ्रॉम एनवायरनमेंट. जो पागल आदमी जैसे पागल होते हैं, तो पागल लोगों में क्या होता है कि उनको बहुत ही ज्यादा इरिटेशन होता है वो बहुत ही ज्यादा इरिटेटिंग होते हैं, वो बहुत ही ज्यादा डिटैच होते हैं. जैसे मैं लेक्चर ले रहा हूँ, आप लेक्चर सुन रहे हैं या कुछ नोट डाउन कर रहे हैं, दैट इज नॉर्मल बिहेवियर. लेकिन मैं लेक्चर ले रहा हूँ यहाँ पे, तो आपको मेरे ऊपर गुस्सा आ रहा है, you are getting irritated with me, that is a nothing but the psychic state. It is a psychic state. That is a psychic person, mania and schizophrenia. So there are two major disorders of your psychic state or peace of mind. There are two major disorders that disturb the peace of mind or that disturb the psychic state of your individual. तो वो कौन से? That is a schizophrenia and mania. Schizophrenia and mania. तो now in case of schizophrenia क्या होता है? schizophrenic patient में क्या होता है? There is a defective input, sensory input. जैसे मैं बैठा हूँ, मुझे कोई आवाज नहीं दे रहा है, लेकिन फिर भी मुझे लग रहा है कि मुझे कोई बुला रहा है। प्रैक्टिकली नहीं कोई बुला रहा, लेकिन मुझे लग रहा है ऐसा कि मुझे कोई आवाज दे रहा है। दैट इज अ डिल्यूजन। इल्यूजन एंड डिल्यूजन। सो इल्यूजन मतलब क्या? फॉल्स फॉल्स सेंसरी स्टिमुलाई। फॉल्स स्टिमुलाई, जैसे मुझे कोई बुला रहा है, कोई नहीं बुला रहा, लेकिन लगता है मुझे कि बुला रहा है। दैट इज नोन एज अ फॉल्स फॉल्स सेंसरी इनपुट और फॉल्स सेंसरी और डिल्यूजन। इल्यूजन डिल्यूजन इल्यूजन इल्यूजन उसको बोलते हैं इल्यूजन। फॉल्स फॉल्स परसेप्शन। फॉल्स परसेप्शन मीन्स इल्यूजन। अगर वो पॉजिटिव है तो उसको इल्यूजन बोलेंगे, वही फॉल्स परसेप्शन अगर नेगेटिव है तो उसको बोलेंगे डिल्यूजन। तो इल्यूजन डिल्यूजन। देन हेलुसिनेशन। हेलुसिनेशन मीन्स व्हाट? मुझे नहीं, मुझे लग रहा है कि नहीं यार पुनीच भगवान है। जैसे बोलता है ना वो कौन, आपका नवाजुद्दीन सिद्दीकी, कभी कभी लगता है साला पुनीच भगवान है, कभी कभी लगता है साला पुनीच भगवान है। दैट इज अ हेलुसिनेशन। खुद को भगवान समझने लगा, हेलुसिनेशन। ठीक है। सो इफ यू आर थिंकिंग गॉड टॉकिंग, जैसे आपको कोई भगवान का संदेश मिल रहा है आपको नींद में, या फिर आपको बैठे बैठे आपको भगवान का संदेश मिल रहा है, तो दैट इज अ हेलुसिनेशन। So delusion, hallucination, and illusion. These are the part of your schizophrenic patient. तो schizophrenic patient में क्या होता है? He detached from environment, कि सामने उसके आसपास क्या चल रहा है, सामने कोई एक बंदा है, अगर मैं आपसे बात करूँ तो आप भी मुझसे रिएक्ट करोगे ना। लेकिन अगर आप मैं आपसे बात करो, आप दूसरी दुनिया दुनिया में खोए हो, दैट इज अ वन ऑफ द सिम्टम ऑफ schizophrenia. So schizophrenic patient, they will be detached from the environment. They will have false sensory inputs. Okay, so like illusions, illusion होगा उनके, उनको लगेगा नहीं यार मुझे कोई बुला रहा है, या फिर मैं स्वर्ग में बैठा हूँ, अप्सरा डांस कर रही है मेरे साथ। ऐसा नहीं होता। दैट इज illusion. Hallucination means what? Hallucination means ये होता है जैसे गॉड टॉकिंग, उसको लगता है कि मेरे पास भगवान मुझसे बात कर रहे हैं। सो आई एम ए मैसेंजर ऑफ गॉड। दैट इज अ हेलुसिनेशन। थॉट प्रोसेस, ओके, थॉट प्रोसेस उसका चेंज होगा। डिल्यूजन मीन्स, डिल्यूजन मतलब वही कि डिल्यूजन मतलब थोड़ा सा जैसे होता है कि मैं ही सही हूँ, मैं ही सही हूँ, मेरा मैं जो बोल रहा हूँ, मेरी जो फिलोसॉफी है वो 100% ट्रू है, मैं जो बोल रहा हूँ वही सब त्रिकाला बाधित सत्य, मी जे सांगतोय ते सगळं सत्य आहे, त्रिकाला बाधित, भलेही ते खोटं असू द्या. So if somebody is proving that my point is only true, your point is wrong, mine is true, mine is right, yours is wrong. Okay, so though his point is wrong, but still he is believing that कि मेरा ही सच है, मैं ही भगवान हूँ और मेरा ही सब कुछ सही है. So that is known as a delusion. Delusion and hallucination. These are the part of your schizophrenic patient. So schizophrenic patient will have aggressiveness, mood changes, swinging in the mood. जैसे अभी बैठा है, आपको नॉर्मल लग रहा है, एक सेकंड में वो इतना गुस्सा हो जाएगा, ये समझ में आएगा, आपके पीछे डंडा लेके पड़ेगा. दैट इज अ aggressive behavior. So patient of schizophrenia will have aggressive behavior, hallucination, illusion, etc. etc. Okay, that is a schizophrenia. Mania is like that same only, manic depressive disorder, MDP. Manic depressive psychosis, MDP, manic depressive psychosis. So major two psychosis, that is nothing but the schizophrenia and manic depressive psychosis. Manic depressive psychosis में क्या होता है कि there is a depression, okay, there is a sudden mood change, सडनली उसका एग्रेसिव बिहेवियर हो जाएगा और बाद में वो डिप्रेस हो जाएगा, मतलब उसका सीनेस डाउन हो जाएगा, मतलब एक बार में बहुत चिल्लाएगा, गाली देगा, बहुत चिल्लाएगा और बाद में शांत बैठेगा. इज अ मैनिक डिप्रेसिव साइकोसिस. मतलब मेनिया हो जाएगा पहले उसको, मेनिया मतलब पागलपन जैसे करेगा और बाद में डिप्रेशन हो जाएगा. सो मैनिक डिप्रेसिव साइकोसिस. इनिशियली वो बहुत चिल्लाएगा, आपने देखा होगा मूवीज, कुछ मूवीज होते हैं जैसे रमन राघव 2.0, तो उसमें जो है सीरियल किलर दिखाया था वो नवाजुद्दीन सिद्दीकी को. सो लाइक वाइज दैट. तो यू कैन इमेजिन और यू कैन कोरिलेट. Okay, so remember it is not important for your GPAT, but I'm just explaining things to you. So there are two major psychoses, that is schizophrenia and manic depressive psychosis. There are two major disorders related to psychic disturbance in your psychic or state of mind. आपका माइंड का स्टेट डिस्टर्ब होने के बाद मेजर दो साइकोटिक साइकियाट्रिक डिसऑर्डर होते हैं. आपने मैंने बोला है schizophrenia and manic depressive psychosis. Okay, now what is meant by tranquilizer? Tranquilizers, these are the drug which which will produce calming effect, which will produce calming effect, so which will sedate you. These are the drugs which will produce calming effect without affecting the normal motor coordination or without producing the hypnosis. These are known as a tranquilizer. Or these drugs are also known as a neuroleptic. Tranquilizers are also known as a neuroleptics. So tranquilizers, they are mostly used in case of psychosis. Tranquilizers or neuroleptic. There are another term like anxiety, anxiolytics. Anxiety means fear. Anxiety means fear. So anxiolytic means those drugs which will reduce your anxiety. For example, your benzodiazepines and barbiturates. So they will reduce your fear, anxiety. Antidepressant means they will produce mood elevation, counteract the depression. So these tranquilizers or neuroleptic, okay, tranquilizers or neuroleptic or antipsychotics. These are the three common terms. Okay, synonyms है antipsychotic, neuroleptic, tranquilizer. These are the three common terms or these are three synonym terms. Tranquilizer, neuroleptic and antipsychotics. These are the three common terms or these are the three terms used synonymously. We'll see. मैंने explain किया है आपको psychotropic and psychoactive drug. So drug which selectively modify the behavior of an individual, that is known as a psychotropic or psychoactive drug.